routine to reduce excessive blood loss, whatever the procedure is, for it, where it be an obstetric or a gynecologic procedure. So this is the postpartum hemorrhage, regardless of route. So pwede silang delivered vaginally or via cesarean section. They were given 1 gram of tranexamic acid upon clinical diagnosis of PPH. So it's really very important that you recognize it early. Kasi later on, we'll discuss that if you give it late meaning more than 3 hours upon clinical diagnosis, wala na masyadong benefit that it offers. So we found out, based on this woman trial, that if you give tranexamic acid early among patients clinically diagnosed with postpartum hemorrhage, it reduced, the primary outcome here is death due to PPH. Ayun naman din yung gusto natin i-prevent, no? However, surgical procedures like hysterectomy was not reduced. But if we think about the primary endpoint, which is death, ayun talaga natin ang maternal mortality, then it's very effective to prevent death from postpartum hemorrhage. So that's the conclusion of this study. So some other studies echo the woman trial. There's modern scientific evidence that there are fewer deaths among patients who receive tranexamic acid early. So the 2012 guideline kasi before, they said that you only give tranexamic acid if yung standard regimen, meaning giving. Ito, we're talking about uterine atony, uterotonics, etc. Pag nag-fail, doon lang tayo magbigay ng tranexamic acid. But in the 2017 guideline of WHO, tranexamic acid is among the mainstay drugs for the prevention and treatment of postpartum hemorrhage. So this is the 2017 guideline. They said that if you give it early, based on the woman trial, you give it early within 3 hours upon clinical diagnosis, then you can prevent and treat PPH. And within 3 hours of birth, no conferred benefit if you give it late. So early recognition is the cure. And PPH, meaning regardless of route, whether your patient delivered vaginally and she bled more than 500 cc or half a liter after delivery or 1 liter after cesarean section. So same pa rin naman yung diet natin, criteria. Okay. So the dose here is to give 1 gram of tranexamic acid, that's 100 milligrams per ml. If you give it at 1 ml in 10 minutes, so dapat slow IV push siya. No? So IV push, within 3 hours, tayo naman actually when you clinically diagnose your patient as postpartum hemorrhage, you immediately give your tranexamic acid. You don't wait naman for 3 hours pa. And then you monitor your patient. After 30 minutes, you can give another dose, and then another dose after 24 hours. Although, as OBGYNs, we tend to, the dose here is quite conservative. Although at that dose, you can prevent and treat postpartum hemorrhage. Kaya tayo nag-aanawan tayo agad. 1 gram cubic na tayo. Or maximum of 4 grams pa nga. Basta nag-bleed yung patient. So this is the recommendation of WHO is based on the woman trial. But if you give it, I kept on saying 3 times ko lang sinabi, that if you give it beyond 3 hours, it confers no benefit. So dapat talaga early siya. So tranexamic acid should be a mainstay, no, in the standard treatment for postpartum hemorrhage. So you give your standard regimen. Siyempre the important thing is, that's why I showed you the slide of the 40s, so that you know ano mo na yung etiology. Siyempre, no, i-address mo what the etiology is. But you give your standard regimen, your uterotonic, especially if it's a case of atony, but you give your tranexamic acid as well. And it should be part of the PPH kit na I'm sure in your hospital. I'm very much impressed by the number of obstetric admissions, 18,000. Marami pa sa PGH, double na ng PGH. So, congratulations on that in the Bicol Medical Center. It should be part of the PPH kit, readily accessible, along with your other emergency drugs. But of course, you have to weigh the risks and benefits. If your patient has a thromboembolic disease, myocardial infarction, stroke, you have to confer with your cardiologist. Pero it's a life-saving drug. So it should be part of the standard regimen for the treatment of postpartum hemorrhage. And so both the FIGO and the International Confederation of Midwives also support the WHO guidelines. So they made a joint statement that you should really give tranexamic acid early on upon clinical diagnosis. And actually the dose is the same. So the 1 gram tranexamic acid given over 10 minutes, and then monitor your patient. Within 30 minutes, if bleeding still continues, you can give another dose, and then give another dose 24 hours after if your patient is still bleeding. Okay, so there's also, I'm sorry, hindi ka gulgulo na yung slide, but there's also evidence. I've been talking about the recommendations on tranexamic acid as a treatment regimen. But what about as prophylactic? Favorite din natin yan. Ang tawag nga natin siya, pampatulog sa gabi, di ba? Para mahimbingan tulog after a surgery. So now there is evidence that we can give it prophylactically among our patients regardless of route, vaginal or CS, but mostly for our patients who underwent cesarean section. If you give it early on, so wala pa yung clinical diagnosis of PPH, you give 1.5 to 1 gram of tranexamic acid, then you reduce the blood loss postpartum, even if the postpartum hemorrhage is not there yet. In that case, you tend to decrease the blood loss as well as the risk of maternal anemia post-surgery. Yan. But of course, you always have to weigh the risks and benefits if your patient has risk for thromboembolic event. So whether she underwent vaginal or cesarean section, but especially for those who underwent CS, then it's a good preventive tool or preventive drug for the prevention of postpartum hemorrhage. So this is a study that I'd like to share with you to the use of tranexamic acid in the prevention of PPH among patients undergoing cesarean section. And this is a systematic review. And across the 36 studies of more than 10,000 women, when they gave tranexamic acid prior to delivery during cesarean section, it significantly reduced the risk for hemoglobin drops, so anemia, total blood loss is reduced, and the risk of your patient losing more than 1 liter, so the risk of PPH is also reduced, as well as the need for other uterotomies. So it's a really good prophylactic drug for our patients undergoing cesarean section. So this meta-analysis suggests that prophylactic tranexamic acid administration is very effective among women undergoing cesarean delivery to reduce postpartum blood loss as well as maternal anemia. This is a study that I'd like to share with you again because it's a local study in a tertiary hospital in Manila. So it was done in Hospital ng Maynila, and it has the same nature as the previous meta-analysis. They want to see if tranexamic acid is very effective as a prophylactic medication for patients undergoing, regardless of route, vaginal or cesarean section. So the patients were randomized and they were given 2 grams of tranexamic acid. If the patient is undergoing vaginal delivery, they were given in the second stage of labor. And if they were undergoing cesarean section, within 30 minutes prior to abdominal delivery. So they found out, so they took the pre and post hemoglobin and measured the blood loss. Among the more than 120 women who were part of the study, it demonstrated that the use of tranexamic acid, whether the patient underwent vaginal or cesarean section, it reduced blood loss as well as maternal morbidity and mortality as well. So what about in our gynae patients? Favorite din natin siya among our gynae patients. So we encounter bleeding among our gynecologic patients, whether they're consulting in the clinic for HMB, heavy menstrual bleeding, or you're going to perform surgery, myomectomy, hysterectomy. So, is there benefit in giving tranexamic acid? So, reviews and reviews as well as RCTs have shown that you can use it for our patients undergoing gynecologic surgery. So, for example, this review states that tranexamic acid is effective to reduce volume of bleeding during menstruation. So, very applicable for our patients undergoing HMB. For example, you haven't completed your diagnostics yet, diba? patient will go to the clinic, you will request for all the labs as well as the transvaginal ultrasound. So while waiting, syempre after ruling out the accidents of pregnancy, kasi kung indicates to undergoing HMB, then you can give your tranexamic acid. It's even found to be more superior to placebo and oral progestins. Pero syempre, kailangan i-assess ko yung cause for the bleeding. Yun naman, like in our obstetric patient, so that you will be able to intervene and give the definitive management. So this tranexamic acid has been found to be an excellent and affordable non-hormonal treatment option. So it's an adjunct that you can give your patients if they are undergoing HMB. So what about in gynecologic surgery? So may use ba siya? So this study also tells us that for patients who underwent hysterectomy, myomectomy, cervical and ovarian cancer surgery, there's a decrease in the intraoperative blood loss or the estimated blood loss during surgery if you give tranexamic acid. So we won't wait until the complete patient. You can give it prophylactically among our patients. So it's very safe also, but always you have to see if your patient has contraindications, stroke, MI, kidney disease, chronic kidney disease, or she's prone to throwing a thrombus or a clot, then you have to confer with the hematologist or the cardiologist. And so, what about for extensive ovarian surgery? So we know that for benign and simple gynecologic surgeries, tranexamic acid is very effective. So this is a systematic review assessing the efficacy if you give tranexamic perioperatively among patients who undergo advanced ovarian cancer surgery. Will it be beneficial or helpful? So although the total mean blood loss is decreased, but wala siya masyadong statistically significant difference. Medyo mahirap naman. Maraming mga gyne-onco dito. But I'm sure, for what it's worth, we will still give tranexamic acid. But more studies are needed for to demonstrate its efficacy for ovarian or advanced ovarian cancer. Okay. So, going back to our patients, they're very common. No? Kasi nasa huli itong Cochrane analysis because it's a fairly new study. So, is it effective among patients undergoing HMB? Mabalik tayo sa heavy menstrual bleeding. So, it compared this systematic review compared tranexamic acid with the other drugs, antifibrinolytics with the other drugs. So, versus placebo, it did reduce the mean blood loss. So, medyo obvious naman yun. Those who were given tranexamic acid has lower blood loss for those patients undergoing HMB versus progestogens, which we commonly give for hormonal imbalance. There's no clear evidence of difference between the groups in terms of mean blood loss, but tranexamic acid was associated with higher likelihood of improvement. So there's still, together with their progestogens, you can give your tranexamic acid with no adverse effects. Versus NSAIDs, tranexamic acid was associated with a reduced mean blood loss, more effective than your NSAIDs. Versus levonorgestrel intrauterine system, mas superior ng konti talaga si levonorgestrel intrauterine system. But compared to the other hormonal and non-hormonal options that we give our patients with HMB, tranexamic acid is very effective. So the authors concluded based on this study that antifibrinolytic treatment, in this case tranexamic acid, appears effective in the treatment of HMB compared to placebo, NSAIDs, progestogens, but not the levonorgestrel intrauterine system. And okay, so in summary, so in obstetrics, we recommend the early use of tranexamic acid within 3 hours upon clinical diagnosis of postpartum hemorrhage and as a prophylaxis for those undergoing vaginal and cesarean section, most effective for those patients undergoing CS. In our gynecologic patients, it's an excellent and affordable non-hormonal option among patients undergoing heavy menstrual bleeding. But syempre, i-associate, ascertain the cause also. And you can use it as an adjunct very safely for your patients undergoing benign gynecologic surgery. But more studies are needed for those undergoing advanced ovarian cancer. So I think This is my last slide. Thank you very much for listening. Take care and shameless plug. Sorry, our Department of Obstetrics and Gynecology with the Foundation for Reproductive Care of PGH will also be having our postgraduate course face-to-face after 3 years in Conrad, July 3 to 5. So here's the QR code, but parang baka ma-toxic kayo sa pag-screen. You can approach me if you're interested to register. Thank you very much.
Thank you, Doctora. That was a very, very interesting updates regarding tranexamic acid. So we may call on Dr. Ana C., Dr. Ana Bresnan, and Dr. Christine Perdigon to the photo wall, please. Handing the certificate to Dr. Raspido. So, we go now to the second lecture series of this afternoon. Our next speaker is a graduate of Doctor of Medicine at UER MMC. He had his residency training in obstetrics and gynecology at the UER MMC. He is the head of the Office of Professional Education and Training at ARMMC, a medical specialist 4, and a past president of POGS. Ladies and gentlemen, here to talk about women's journey in choosing the best family planning method, a case on special population, the distinguished Dr. Raul M. Quilimon.
Mayong maayo tuloy Bisaya tuloy ako. I thought I'm in Iloilo. Magandang hapon po sa inyong lahat, mga kapatid ko, mga doktor, mga nurses, at mga midwives. And I'm very happy to be back here after several years. I think the last time I came here was in 2018 or 2019, before the pandemic. And now I'm a COVID survivor, and I'm very happy to be alive and kicking, and sharing with you some thoughts about family planning, and then later on, towards the end of the day, about wound healing. So I will be sharing with you 2 lectures this afternoon. Okay, so my task at this particular hour is to discuss with you the woman's journey in choosing the best family planning method. And we have a special case that I will be discussing, and her name is Kathy. So this is the journey of Kathy. We will go through her life cycle from being an adolescent to until such time that she reaches adulthood and perimenopausal period. Because this age group, the adolescent and the perimenopausal age groups, are still within their reproductive age. And when they get pregnant, they will be at a higher risk. No? Ibig sabihin, maraming complications na kaakibat doon if they get pregnant. A while ago, one of our presenter presented the data on teenage pregnancy, on their data on the People Medical Center, and I noted that the teenage pregnancy rate is also very high. And in fact, the morbidities coming also from the mothers in terms of the perinatal morbidity is also very high among this age group. Okay, so this is Katie and her journey in choosing the best family planning method. And this module was prepared actually by one of our colleagues, is now a member of the Board of Trustees of POGS, Dr. Romel Dueñas from FEU. Pero hindi kami makaparan ni Dr. Dueñas, wala naman siya dito, kundi ko siyang laitin ng konti. No? I'm several pounds or several kilograms lighter than him, and I have more hairs, kahit ang anit ko pa nun na I have more hairs than him. So pwede niya ako isoko pagkatapos na ng lecture ko kasi makabawi na itong module. Okay, and since this is an industry-sponsored lecture, I would like to make a disclosure that I am one of the key opinion leaders of DKT, and I give lectures all over the Philippines with remuneration. So I will be receiving something after this lecture which you won't be receiving. Okay, so these are our objectives for this particular time. To determine the family is a 17-year-old whom you met at a medical mission. Gusto naman ngayon ng medical mission. And even if specific age group in your practice who come in because they want to have a prenatal checkup. So she is sexually active at 17, and our questions would be, does she require contraception? Kailangan bang bigyan siya ng contraception para hindi siya mabuntis? And we are preventing actually teenage pregnancy, and by preventing teenage pregnancy, we are also decreasing or lowering down the teenage pregnancy mortality and morbidity rate, as well as the neonatal mortality and morbidity associated with teenage pregnancy. And the second question is, ano ang ideal method? If she needs a contraceptive method, what is the ideal method for her? Actually, I refrain as much as possible from using the word ideal because there is no such thing as ideal. No? Most appropriate would be the proper term for that. What is the most appropriate for that particular age group? Okay? And how will we counsel Katie in terms of family planning methods? Okay, so this was already mentioned a while ago, Republic Act 10354, which is also known as the Responsible Parenthood and Reproductive Health Law. Okay, and I have the opportunity to be part of the group which came up with the implementing rules and regulation of this Republic Act due to my being president of POPs during that time. That was in 2013. Article 7 of Republic Act 10354 states that no person shall be denied information and access to family planning assistance except for minors who needs consent from parents and legal guardians. Ano ang ating age of, kung minor ka dito, anong age? Hanggang anong age? 19. Kasi teenager, di ba? In age 19, is considered minor. Okay? In other words, if a 17-year-old like Kathy comes to you to ask for an advice regarding family planning method, you can give her, pero may ano yun, may condition, that the guardian should also be present when you give her counseling. No? Okay. Kasi pag ginawa natin yung counseling na wala yung parents, at malaman ng parents kasi some of the parents are aware of what the Republic Act 10354 is, you are liable for that. Binigyan mo ng contraceptive ang bata na hindi ko alam ang tatay, pwede kitang ihabla. Okay. Young parents should be encouraged to involve their parents or adult guardians in their care and be offered counseling on their refusal. This is what we do. I was with a government hospital in Manila, Marikina, and before we discharge patients who are teenage mothers, we advise them on family planning, on what is the most appropriate family planning for her. But we call the parent or the guardian to be with her. Anong dahilan kung bakit kailangan natin ng mga magulang nila? Kasi the parents who are responsible, quote-unquote, are the ones that should remind these young mothers about the benefits and about the practices of family planning, about their compliance. Kasi kung walang reminders ng mga bata ito, mga ano yan mga ano lang sila, carefree lang sila, so they don't really care about this different methods. Sa kanila lang, makakaroon lang sila ng magmumungol lang sila through text or through any social media. Mumungol tayo sa likod ng SM Naga. The following month, wala nang regla yan. Buntis na yan. No? Kung sa mga estudyante, anak mo magpapaalam sa'yo, Mami, mag-overnight ako sa
Akala ko naman kung sino.
bahay ng classmate ko kasi may group project.
Yeah.
So, pinayagan mo kasi number
Baka
one
dito.
yung anak ko sa klase. Sige lang, iya, I trust you.
Sino?
Mama,
Ano
tapos
ito?
sabi ng mama,
Dr.
I think
Karen?
I'm pregnant.
Ah, talaga?
Bakit ka nang pregnant, anak? Once ka lang lumabas ng bahay, pinayagan kita para mag-group work, mag-group assignment, gawa kayo ng assignment. So, sinong tatay? Sabi ng bata, hindi ko nga alam, mami, kasi nga group project nga eh.